Thank you, Asaf. And it's a real pleasure to share this work actually on World Patient Safety Day. And Asaf is right. This is something I've been very passionate about. And what I want to do is share with you a project that we have to improve the communication to and care of patients and providers after they've experienced a real failure of delivery, a medical error. Our goal in this project is to create a path to scale communication and resolution programs. And I want to thank this work has been supported by the Olam Family Foundation and the Philadelphia Foundation. Next. You know, we really haven't made the headway that we want on patient safety, in part because we've struggled with transparency. This survey published in Health Affairs reveals that doctors report that they don't always disclose medical errors. Rosemary Gibson's book highlighted the deny and defend approach by medical malpractice insurance companies, which really has created this wall of silence for patients, and also shuts down the learning that should go on by providers and healthcare organizations. You know, responding to medical error is really a part of healthcare where we should be the most patient-centered, right? It's a real stress test of our system, but it is perhaps the area that we are the least patient-centered. Next slide. So CRPs are their principled, comprehensive, systematic programs for responding to and preventing adverse events. They help move from traditional deny and defend responses to a transparent response with immediate communication. They help organizations learn from errors, and they help move to earlier financial resolution for patients who've been harmed, while creating a very supportive environment for both patients and providers, really taking the fear and worry out of a very stressful process. Next. You know, the uptake of CRPs is increasing, and you probably have heard about it, but the success of the field is really threatened by inconsistent implementation, and that's what we have seen. It's not being used across the board. Some organizations tend to cherry pick, right? They're only looking at doing CRP for the most egregious cases that they know there's going to be a lawsuit. Or some organizations use some of the elements, but not all of them. And this inconsistent implementation has really fueled skeptics' concerns that CRPs are really just a claims management strategy dressed up in a quality and patient safety rhetoric. But we argue that CRPs need to be seen as mission critical to the learning and the safety culture of an organization. It really needs to be part of the way in which quality and patient safety is done within an organization. Next step. So we've postulated really 3 key steps to successful implementation of a communication and resolution program. The first is we need good metrics to track processes, have good definitions, and good definitions of outcomes and processes. We need to have standard work. We think this can be done with simple tools and training. And third, we believe that you can apply an implementation and a quality improvement systems approach to implement. Next. So this project started saying, let's create metrics. Let's create the metrics and definitions that we need for this. And we knew that if we could create metrics, we would provide an opportunity to improve the implementation. We could create benchmarks, and we could use these metrics to guide comprehensive implementation. Next. To create our metrics, our process, we started with an extensive literature review. We wanted to learn everything we could out there to make sense of what was currently being done in the field. And then we turned to colleagues and peers for input. We hosted focus groups and did interviews and expert convenings to really ground ourselves and understand what all the stakeholders thought was important to capture in CRP measurement. We then engaged all these stakeholders. We had risk managers, quality specialists, leaders, liability insurers. And then finally, we conducted a series of face validity and rapid cycle feedback tests with our partners to see if we could improve our metrics. Next. So After a year-long journey, our team finished the design of the data set. We developed really 4 domains for CRP metrics. One was, what is the environment for CRP, such as a culture of safety and the numbers of defined events. Second was around the steps, the actual processes. Third was around how do organizations manage serious safety events. And the fourth was the actual outcomes from CRP in terms of claims and experience. Next. So with this data set complete, we did a 3-month pilot test. We had 5 organizations. We asked them to give us feedback on this and then to actually use these metrics and give us their data. We were really happy to have organizations from large academic medical centers to smaller just physician practices. Next. Next slide. There we go. So this is some of the data. The organizations were really able to give us feedback. This slide really highlights some of the feedback that we saw about these measures. Most of the organizations felt the measures really helped them to improve their CRP implementation, and several of the organizations reported that it drove improvement, and in the areas where they had trouble retrieving some of the data, it allowed us to iterate and actually change the data collection methods. Next slide. Just to highlight a couple things so you can see what some of these measures look like. In that first domain of the CRP environment, we really recognized that we needed to have specific standard definitions of what's a CRP eligible event, what's an actual event, and what's a serious safety event. In order to create these measures, we needed to have standard measures, and as an organization and as a healthcare delivery system, we need to have these agreed upon definitions in the sense why we think the importance of having standard metrics exists. Next slide. Here are just some of the data on these overall environment results. You can see the number of what we call CRP eligible events over these 2 years at these pilot sites, the number of CRP actual events, and the number of serious safety events. This is where harm or death is really occurring. And you can see that the numbers are actually pretty significant. You know, some people argue that CRP may not be necessary because events are pretty infrequent. Well, we believe that this is not the case, as we saw very significant numbers across all of our definitions. Next slide. So as we continue to refine these metrics, our goal is to help organizations by using a dashboard approach. Here you see the 4 domains and these subdomains. So an organization can see how they're doing in terms of the environment, culture of safety, and how they're doing in terms of the number of eligible events and actual CRP being done. The steps, these are the actual processes. How are they doing at reporting events, event analysis, and then resolution? Are they getting to that early financial resolution? How are they managing serious events in terms of communication, and are they actually improving? And finally, outcomes in terms of experience, and then numbers of new claims that they knew nothing about. The idea is that if they're doing this across the board, they'll have very few events that they're not aware of. Next slide. So in addition to developing these measures, what we're doing now is we've looked across and said, well, what tools do we also need to help people implement? They'll have a set of measures. Now we're finishing developing these tools which can promote standard and a principled approach. Next slide. We've evaluated what are the elements of a CRP program. There's basically 5 big areas that we see. These tenets are around buy-in at an organization, timely response, transparency, patient and safety analysis, and then resolution. And each of these can have standard tools to help implement. Next slide. Where we're going with this is we're taking the metrics that we've developed, we're taking the tools, and we're going to create what we're calling an action network. We're starting to recruit now for an action network to start in 21 with about 15 health systems to help be part of this action network. And what they'll be using is implementation support, a digital platform that we have here at Ariadne called ARIA, and to a place that they can download tools and use it for metric reporting. And combining the tools, the metrics, the digital platform, and this learning community will create this action network. And our goal is to test this to see if we can successfully scale a CRP program. Next slide. So for more information and to see about perhaps joining us in our work, please let us know at Ariadne. We're very excited by this action network, and we'll continue to report back to you on how we're doing to hopefully help scale CRP programs.